Hey, good morning, everybody. Welcome to St. Elizabeth Business Health Services webinar for occupational health in Dearborn County. Thank you for joining us. St. Elizabeth is partnered with the Dearborn County Chamber of Commerce and One Dearborn Economic Development to invite Dearborn County's many great employers like you and your businesses to this virtual learning opportunity today. Before we get into it, we should do some introductions. My name is Mike Perleberg. I'm the Executive Director at One Dearborn. Joining us for the presentation today is Eric Kranz, President and CEO of the Dearborn County Chamber of Commerce. Also with us today, Chris Carley, COO of St. Elizabeth Dearborn, Tina Legree, Director of St. Elizabeth Business Health Services, Dalen Garland, Senior Account Executive with St. Elizabeth Business Health Services, and also Nick Maglick, a St. Elizabeth Administrative Fellow who put this event together for us today. We'd like to ask our guests to introduce themselves in the chat window. So I'll ask you just to type in your name, business, and your position title, even your email if you like. If you would please, as we get started, just put that in the chat. And a few ground rules. Please try to keep your microphone muted unless you're presenting or asking a question. We also ask that you please save your questions until after the Business Health Services presentation. And then we'll open the floor for a question and answer session. And if you have a question during the Q&A, you'll be welcome to either turn on your microphone and ask or type it in the chat window, whatever you prefer. Now let's give our attention to the stars of the show here. That is the St. Elizabeth Healthcare team. One Dearborn and the Chamber of Commerce believe Dearborn County is incredibly fortunate to have this awesome healthcare provider serving our community. And we'll start with Mr. Chris Carley, COO of St. Elizabeth Dearborn. Chris?
Well, thank you, Mike. I hope everybody can hear me okay. And you're starting off with the dullest star in the group. I'd like to thank Nick for putting all this together. Nick is a very talented administrative intern that we have right now that's working on his master's degree at Xavier. So, Nick, want to thank you for that. I'm coming to you live from the Creation Museum. I got caught in between appointments, and believe it or not, there's zip lining out here at the Creation Museum right now. So get to take a look at that. I want to thank everybody for being here today. What we're trying to do at St. Elizabeth Business Health is build a better mousetrap. We need your input to actually do that. We want to bring all the services that we possibly can out to Dearborn County. As most of you know, we're going to be embarking upon about $100 million building project with regards to a cancer center and a new hospital. But in the meantime, we want to make sure you have access to the latest and greatest, whether it be healthcare or business related types of services. So that's what my team of stars, and they are stars, of Tina Legree and Dalen are going to be talking about right here. So with that as kind of an opening foray, I'd like to turn it over to that team of stars. And thanks again, Mike, to introduce themselves. And really appreciate everybody being here. So thank you. Dalen, I'll turn it to you.
Perfect. Good morning, everyone. My name is Dalen Garland. I'm the Senior Account Executive here at St. Elizabeth Business Health. My role kind of encompasses the sales and marketing portion of business health, as well as the communication with all of our companies, whether that is to start a new profile, you want to add or take away any services with us. That's kind of my role here at St. Elizabeth Business Health, and I'll turn it over to our director, Tina Legree.
Good morning, everyone. My name is Tina Legree, and I'm the Director of St. Elizabeth Business Health Services. I have the pleasure of leading a team that are dedicated to providing services to local business and industry. And Dalen will go into all those service lines and educate us on what all we have, but we're always here to help you with whatever your needs are. Thank you.
Perfect. So just to kind of give you guys a brief overview of what St. Elizabeth Business Health is here. We have 15,000 square feet facility, state-of-the-art facility that encompasses an x-ray machine here at Mineola Pike, 11 exam rooms. We have 2 procedure rooms, 2 lab work rooms, 2 audio booths. We have providers who are board certified in occupational medicine. We have a dedicated drug and alcohol coordinator, and we're audited regularly by the FAA and DOT. And we're conveniently located off of Interstate 275. So I'm going to go into the services of business health and kind of an overview of who we are even further. So we have a full continuum of occupational medicine in our division, offering regional services for over 25 years. And Tina will kind of speak to it later on in the presentation about just the growth of business health over her experience here in our 25 years. So what we offer, we have 2 occupational medicine clinics, one here in Erlanger, this is our main location, and then one in Florence, Kentucky. We have our employee assistance program located here at Mineola Pike. We have our work rehabilitation center. We have our wellness, travel medicine, our CTAs, which are CT coronary angiographies, and our on-site services. And I'm going to go into more detail later on about each of our services. So the goal of business health here, we want to partner with employers to provide excellent care and innovate treatment with an exceptional service. And to encompass business health in a nutshell, that statement is who we are. This is a partnership. We work very well with our companies. It's not a one-way street. We don't dictate what goes on with the care of your employees. Obviously, we have our medical doctors who have the say-so when it's medical, but we do a great job partnering with our companies. Our innovative treatment speaks a lot of volumes about who we are. If there's a service out there in the occupational healthcare industry that we don't have, we create that. Just the other day, we had a guy reach out that wanted a bomb squad physical for the FBI. And, our providers were very excited about this opportunity. It's not something that's come across their desk before, but very quickly, we were able to accommodate that and get him scheduled for his appointment. An exceptional service. Obviously, we're in the business of people. I say it all the time. They said we're in the business of people, and we strive to give excellent service. So another one of our goals is to reduce workers' compensation and healthcare costs, along with reducing lost work time. We want to make sure that we get your employees back to work safely and as quickly as possible. We want to develop more motivated and productive workforce. That goes, without saying. Obviously, we want to keep people healthy and keep them productive and motivated at work. We have providers who understand your company. Our providers love to get out into the field. They love to take tours of facilities, see exactly what the day-to-day operations are of your jobs. That way, if there is an injury that comes through in their mind, they know exactly how this injury could have happened, and they, give tips and tricks on how to prevent that from happening again after they treat said injury. Another one of the goals is obviously to manage time by working with a single vendor. When you work with Business Health, everything is in-house here at Business Health. Our billing department, our EAP, work rehabilitation center, everything is in-house. So you're not going to have to call a bunch of different places to actually get your answers for any questions that you may have. And last but not least, we have enhanced employee confidence with employer providing best care possible. We do everything with great privacy and confidence with our employees and our patients. So we make sure we protect their confidence and anything that we may see. So our providers, our lead physician is Dr. Evan Davies, who's board certified in occupational medicine, followed by Dr. James Keller, who's also board certified in occupational medicine, followed by Dr. Patrick Kunkler, who is board certified in family medicine, but he has 15 years experience in the occupational healthcare industry. And they are followed by our 2 APRNs, Dana Parker-Kist and Jonathan Barney. And as I mentioned, all of our doctors are very accessible. They love to get out and tour facilities. You can schedule a time to actually speak with our physicians, and that just speaks to the exceptional care that they want to provide our companies and employees. So our clinic locations, as I mentioned, we have our main hub here at Mineola Pike. So our Mineola clinic also encompasses our EAP program, and we're located at 4123 Olympic Boulevard in Erlanger, Kentucky, right off of 275. And then we have our Mount Zion location as well at 195 Investment Way, Florence, Kentucky. And I'll give you guys a second. I'll pause on this screen. That way you can see our business hours if you want to write anything down. But at the bottom here, you have our urgent cares. We have our Crittenden, Greendale, Fort Thomas, Florence, and Highland Heights. And then our emergency departments as well in Covington, Fort Thomas, Edgewood, Florence, and Grant. And obviously, this piece isn't updated. We have our Dearborn community as well. So I'll pause here for a second in case you want to write anything down. Perfect. Moving along. So our clinic services. So our clinic services are not limited to these services specifically, but these are just some of the main services that we offer in our clinics. Number one being our physical examinations. So we do post-offer occupational healthcare physical examinations We do DOT exams, fit for duty exams, fire and police exams, FAA exams, and immigration exams as well. We do our DOT and non-DOT drug and alcohol testing, and we have a specific coordinator for our drug and alcohol testing. So she's dedicated to specifically that. She gets results out in a very timely manner. So it's awesome to have a dedicated drug and alcohol coordinator. We have our injury care and injury prevention strategies in our clinic. The best way to describe our clinic is if it's not life or limb threatening, we see it here at St. Elizabeth Business Health. So that kind of gives you a good picture. We can handle burns, bruises, breaks, sutures, abrasions, you name it, we see it here in our facility if it's not life or limb threatening. We also have our respiratory fit testing and OSHA respiratory compliance programs, followed by medical surveillance, pulmonary function test, audiograms, Hep B, vaccinations, flu vaccinations, and hearing tests.
Did you get your money from Dana?
We have our travel medicine, as well as our executive physical program and our on-site medical services as well. And for our on-site medical services, we do firefighter exams on site. We do drug testing on site, vaccines on site, you name it, we can do it on site as well. So here's our 24-hour care for your work-related injuries. Obviously, within business hours, please visit our clinics here on Mineola Pike or our Florence location off Mount Zion. Our business hours are Monday through Friday, 7:30 a.m. to 6 p.m. at our Mineola clinic, and then 8 a.m. to 5 p.m. at our Florence clinic, or Mount Zion clinic. And then you can see urgent care hours, Monday to Friday, 10 a.m. to 8 p.m., Saturday to Sunday, 9 a.m. to 7 p.m. as well. And there's the locations. And then obviously our 24-hour, 7-day-a-week care are at our emergency departments. And I'll pause for a second if you need to take time to write something. Perfect. For our on-site after-hours drug and alcohol collection services, if you need drug and alcohol collection services after hours when our locations are not open, you can reach out to the company ODAX at the 513-236-2102. So if it's a post-injury drug and alcohol test, or if it's post-incident or reasonable suspicion drug and alcohol test, you reach out to ODAX. They actually come on site to your facility and they're able to do those tests for you. And I'll pause here for a second as well, so you can write the number down. Perfect. So this slide is going to be handled by Tina. The Employee Assistance Program is very near and dear to her heart. So I will turn it over to Tina. And
thank you, Dalen. As Dalen said in the beginning, St. Elizabeth Business Health Services has been in existence for a little over 25 years, and I've been with it for 26 years, starting as the director of the Employee Assistance Program. So I'm a mental health therapist by training. So he is very correct. This is near and dear to my heart. Our Employee Assistance Program is a traditional staff model EAP. It's not a 1-800 number that is in conjunction with an insurance product. It has dedicated mental health staff. Our therapists at St. Elizabeth EAP are master's or PhD prepared and independently licensed in the state of Kentucky, Ohio, and Indiana in order to provide therapy. The bulk of what we do is in the Employee Assistance Program is marital, family, individual therapy for individuals that voluntarily or self-disclose and want to come and get assistance from us. It's extremely confidential. We have our own EMR system within EAP. It's separate from both our occupational medicine within business health EMR and from the hospital. It's housed in its own place so that we can protect even our own hospital employees that opt to use our Employee Assistance Program. We are available 24 hours a day, 7 days a week for crisis. And our appointment hours are Monday through Friday from 9 o'clock in the morning until 7 o'clock at night. There's always a crisis slot available. So if an employee has an issue, they can be seen within 24 hours of calling in. In addition to the resources for the individual, we are also a huge resource for the employer. We do supervisory referrals based on job performance issues. Our goal in the EAP is to get the problems off of your desk and put them onto our desk. Anything from absenteeism, tardiness, We've had situations where employees cannot get along. We call it workplace marital therapy. We'd be happy to see those individuals and help resolve those issues. We also do on-site critical incident stress debriefings. Those are, knock on wood, in case you have an industrial situation, an accident, death of a coworker. Therapists are available 24 hours a day, 7 days a week to come on site to an employer in order to help resolve and to support your employees. And that's just it's a wonderful resource to be able to pull everyone together to be able to provide them that mental health assistance. We also provide on-site educational training for managers and employees. We do a lot of the compliance training from sexual harassment, drug-free workplace, DOT, supervisory and driver training and education. But we also do a lot of fun trainings in EAP, how to deal with difficult people, secondary trauma with COVID right now. There's a lot of people that are experiencing a lot of secondary trauma. It's not the first situation that you're seeing. It's after 25 of these situations that finally that's the one that kind of, broke the back and we need some support to get through it. So we have educational sessions available for that as well. We also have fun ones on how to handle difficult people and how to handle your difficult boss sometimes. So we also develop anything that an employer wants. We have a beer distributor that wanted a training on defensive driving. Wasn't exactly what we normally do, but we happily developed that for them. We also case manage cases for you. So if you have an employee that maybe they were outside of the scope of the EAP for therapy and we needed to refer them on based on job performance issues, we're the point of contact. We take it off of your desk. The treatment providers are communicating through the EAP and letting us know that they're safe to return to duty. And that's part of that fitness for duty process. We're able to tell you whether or not from a psychological or chemical standpoint, if they're safe to be an employee for you, provide you with back to work agreements, kind of the do's and don'ts of what they need to do in order to be safe. In addition, we also do Department of Transportation. We have 2 substance abuse professionals certified by DOT, myself and Kip Hatcher, who are available to do any DOT required evaluations. And those are really hard to find. And for companies, they are required under DOT to give them a resource and a tool. The last thing I'd probably like to say about EAP is that we go above and beyond to protect the anonymity and confidentiality of the employees that are seen by us. We designed our suite in EAP in a U shape to where employees come in one lobby entrance and then they exit out a separate exitway. So they're never going back through the lobby in case there's someone there that they might see or recognize. In addition, if they're a self-referral to us, we tell people if you're not comfortable giving us your name, we're okay. It's your one chance to be a superhero. You can go by Batman, Spider-Man, Superman, whatever it is you'd like. At one point in time, we even had Bill and Hillary Clinton in for marital therapy. That was very interesting. But if there's a name that people like to use, that's fine. The only thing that we ask is that they don't use a coworker's name because that gets really confusing when that coworker wants to use their benefits. But we do have John Doe, Jane Doe charts. Our goal is really not to focus on what the individual's name is. It's really to get them the support that they need. And this benefit extends to family members as well. It's not just the employee, but it's anyone living in their household. If there's a brother that moved back in with you while they're going through a divorce, perfectly appropriate for them to use the benefit. I used to never have to make a exception or clarifying, what family members were until we had an individual that called and wanted us to see their depressed dog because their other family dog passed away. So I do have to disclaim and say that we're not capable of doing pet therapy. I'm really sorry, but we'll be happy to give them a pat, and a rub and a bone, and that hopefully will make them feel a little bit better. If there's any questions about the EAP, feel free to hold those to the end or put them in the chat. We'll be happy to answer those for you. Back to you, Dalen.
Perfect. Thank you, Tina. So moving on, we have our move to the next slide. There we go. Our Work Rehabilitation Center here at St. Elizabeth Business Health, championed by Mike Chitwood, who's our occupational therapist. One of the main things that we do here for work rehabilitation are job placement assessments. These are an awesome way to assess if an employee can produce the essential physical demands of a job. And to kind of give you a picture of what that looks like is it's post-offer assessment that will be done here at Business Health. And let's say, for example, there's a meat packaging company and they have to take 50 pounds of meat off of a conveyor belt and put that onto a truck. Mike would actually go on site, do an analysis of what that job entails, write up this JPA. You would send your employees in, they would perform the essential physical demands of the job. Mike would mimic that in our clinic here, and he would give them a red, yellow, and green pass-fail grade. So obviously, if it's red, it means they didn't pass. If it's yellow, it means they passed, but they could work on their mechanics. And then green is they're good to go. They pass with flying colors. Mike's not in the business of HR, so he cannot tell you who to hire or who to fire. He just writes the report up, sends that to you, and you make the decision on if you want to hire that person for that position or find them another position that they can do. So our functional capacity evaluation, it's similar, but it can actually determine the duration of a time. So it's used to determine a patient's current physical capabilities regarding their functional and work type tasks for a duration of time. So if that's a 4-hour duration of time, we can assess that 4-hour duration if they're able to perform those tasks. So our work hardening program is to get someone prepared to go back to work for full duty. So essentially what they would do is they would come in and we would mimic the job that they would be doing on a day-to-day basis, and they would do it in moderation up until the time where they're certified to go back to work for full duty. Our injury prevention education classes, a very nice tool to have, a very nice service to have for your company. Essentially, it's basically an education on how to prevent injuries at work, whether that's how to carry a ladder, how to climb a ladder, how to get down from a ladder, things to do when you're driving a forklift, things to do when you're not. So it's just a good education purpose. And then last but not least, our workstation ergonomic assessments. Mike would come on site, and let's say that there was a certain area of the workforce that is having a bunch of back strains. And they're doing this certain job, and you notice that there's a spike in back strains for this one job. Mike would be able to come on site, assess the injury, assess the workstation, and give tips and things on how to improve that and prevent injuries as well. So moving on, we have our CT coronary angiography. This is a 3-dimensional picture of what goes on around the heart. And I'm not sure if we still have Mr. Carley on here or not, but he was telling me a story about how someone purchased one of these as a Christmas present. So this is a really nice way for you to know exactly what's going on in your heart and to prevent, obviously, any damage going on in your heart. You can know about it right away. So some of the key factors that may increase risk of heart disease or untimely heart attack are high blood pressure, high cholesterol, diabetes, obesity, unhealthy diet, physical inactivity, too much alcohol, tobacco use, and family history. So who can benefit from a CTA? My answer is anyone. Anyone can benefit from a CTA to know exactly what's going on in your body. It's a very useful tool to use, but some of the people that are more prevalent are individuals with elevated risk of family history of heart disease, individuals with unusual chest pain syndrome, and individuals with inconclusive stress test results.
Jalen, I would add to that we do this under our wellness area and offer it to the community as a wellness screening. It's not meant to be diagnostic in nature. It's meant to be a screening tool. And we're really finding things like the widowmaker, a lot of blockages, things of that nature. And we're really seeing about a 20% positivity rate when it comes to that CT angiography. So it's just a fabulous wellness screening that employers can extend to either their senior leadership or their employee group. We also have employers that give it away as a wellness incentive, as kind of a gift.
So Tina's going to take the next slide as well. So it's perfect timing.
There you go. I should have just kept going. We also, within our division, are very pleased to have a wellness area. Our goal in business health was to really take everything that we thought an employer community would benefit from and put that under one umbrella. One umbrella with, again, one director with a billing department and IT specialists, so that really if an employer had any questions or concerns, to Dalen's point, they weren't jumping around the organization. They were really coming to one centralized spot. Our wellness area of the division is probably about as flexible as any area in our division. It is extremely customizable. We meet with employer groups and they tell us essentially what their goal is. Is their goal just to provide another benefit to their employees? Is their goal to move the needle on their healthcare spend? And based upon those goals, our wellness team will meet with them and kind of develop based on their budget. We have companies that come to us every year and say, I have $250 to spend and that's it, but I want a wellness presence in my organization. Fabulous. We can help you design something so that your employees know that wellness is part of your culture. We do have an interactive, customizable wellness platform. It can be labeled with an employer's name as well. It can offer challenges. It can track biometric screenings. It can really be something that the individual uses for coaching if they have a chronic condition that they want to manage as well. We also provide annual biometric screenings. We do that on site. It's a fabulous, fabulous on-site screening tool. It's a one-stop shop where employees sit down with a nurse and they get their blood pressure taken, their height, weight, their body comp. We do a finger stick to tell them their cholesterol, their triglycerides. We break it down for them. And it's an education point because for a lot of people, they haven't spoken to a healthcare provider all year. So that nurse is able to educate them on what their next steps are. If their blood pressure was high, encouraging them to follow up with their doctor. We also provide health risk assessments within that area. So we try to provide anything that employer is willing to offer to their employer group. Health fairs are a popular service, not as much during COVID, but hopefully once we get past this, we have educational booths, we have interactive booths, we have food demonstration booths, smoking cessation booths, we have fitness challenge booths. So anything that an employer would like to see, typically we have an educational component attached to it. Coaching and consultative services, one-on-one or group formats are available. That could be around weight loss, that could be around fitness, it can be around total or general health. We also provide on-site flu shots to employer groups, and we probably do about 12,000 flu shots on site at our companies in any given year. Our incentive development and design component is really part of that wellness platform. If an employer wants to be an incentive-based wellness provider, we will help them track that. We will help you provide the guidelines of what's appropriate. We work with a lot of brokers and healthcare consultants, so we're happy to meet with them in conjunction with the company to help set the parameters, whether or not it's incentive based on participation all the way from numbers driven. We also provide employers with an aggregate report. The individual knows how their health is, but it's so important for that employer group to get an aggregate report of your workforce. And then we can help you look at that and decide if you have money to do educational sessions or another screening, where would be the best use of your resources? A lot of companies will just do a biometric screening, and then they will encourage based on calendars of, Heart Awareness Month. We'll help connect them with the Heart Association, with the American Lung Association, to try to tap into any free resources that are also within the community. I think that's about all on wellness. Dalen, back to you.
Perfect. So next we have our, there we go. Tick change. There we go. Next we have our travel medicine and immigration physicals that we offer here at Business Health Services. So travel medicine, it's pre-travel preparation and education, pre-travel consultations, vaccines and immunization evaluation, and personal medication. And the best way to put this is if you're traveling outside of the country, it's a good way to know exactly what to be prepared for and some good education that's necessary before you do take on your travel.
Can I add something to this one, Dalen?
Absolutely.
We see a lot of this with not only business trips, but also mission trips and personal trips. So if you have somebody that's traveling abroad for their country or a mission trip, we're more than happy to do those as a group and then look at the immunization records individually. Dr. Kunkler is certified in travel medicine. It's really, really interesting. He goes through a lot of preparation. He'll ask you where you're traveling to, look at all of the conditions that are going on within that area, and really help you design a medical plan before you travel. Write any prescriptions that you might need, whether or not it's for antibiotics, whether or not it's for preventatives, even going so far as to look at the sunscreen and the insect repellent that's most appropriate for that region. He also does a lot of education. We kind of laugh around here. His standard rules of thumb are, you don't eat the lettuce, you don't pet monkeys, and you don't ride elephants, because of the things that are on all of those. So he goes through a lot of time in educating people. It's a great service, again, for business or for personal.
Thank you, Tina. So our immigration physicals as well, our adult examinations, which are 15 years or older, typically consist of a physical examination, blood tests for tuberculosis and syphilis, and immunizations are dependent on their age and medical history. And then our pediatric exams for the children 14 years of age or younger consist of a physical examination, blood test for tuberculosis, and a review and update of their pediatric immunizations. Tina, would you like to add anything on this one?
Yeah, the only thing that I would add to that is that we are very blessed to have 2 of the five what the government calls as surgeon generals on the East Coast. So for individuals that want to work in our country, or for several countries, and specifically New Zealand, Australia, in order to work in those countries, they require an immigration physical, and our physicians are certified by the government to provide those things.
So here we have our contact list. We pride ourselves on being accessible to our community. So please feel free to reach out to us. We always make sure that we answer back within 24 hours, or try our best to do so. So our director, Tina Legree, who you guys have heard from, is there. Our nurse manager, Angela Wallace, who manages both of our clinics, does a phenomenal job. She has her MBA, so she has the business mindset, but she's also a registered nurse. So she does a great job of balancing the two and being able to speak clinical if a company does call in and has any question. She oversees, obviously, our on-site services as well. So she's an awesome resource. You have me, the senior account executive, who I'm here to answer any and all questions, setting people up with their new profile with us, adding services. You can call my line or email me at any time if you just have questions. I'm always available. Dave Welser, who champions our employee assistance program, and then our lead physician, Dr. Evan Davies. And with that, I will turn it over. Thank you guys so much for your time and consideration. And now we will take questions. Correct?
Yeah, if anyone has any questions, feel free to type them out or raise your hand, right? As always, everyone's rushing at once to ask their fantastic questions. So is there physical therapy as part of all of this?
Tina, you want to take it?
Sure. Our physicians do refer for physical therapy if the work injury would benefit from it. And we have the luxury of using St. Elizabeth's physical therapy department, which I believe, correct me on this, Dale, and I believe has probably 12 or 13 different locations. So our goal is to get them as close to their employer or as close to home and what's convenient for them. And then our physicians have access through Epic to be able to monitor their physical therapy, because their goal is to get them back to work, look at work restrictions, anything that they need to do. Would like to add too, something that we didn't cover or talk a whole lot about is we do on-site services, but we also do on-site clinics. We have currently 5 employer groups that opt to have a full-time dedicated business health staff at their location. And this ranges anywhere from an EAP mental health therapist to nurse practitioners that can do everything, including suturing on site at their clinics, to RNs that are managing drug screening, onboarding, screenings, helping them manage their workers' comp injuries so that they're kind of the go-between on site. And we also have nurses that are on site that specialize in wellness for companies that really have a strong wellness push. So that's one thing that we didn't cover a whole lot of. Separate from business health on the physician side of the organization, we also have company groups that have an on-site primary care clinic. So that's something that St. Elizabeth is also equipped to provide if anyone is interested in looking at that option.
What are the sort of capabilities or the future plans to, or is there any thought or plans to expand the capabilities of some of these things in Dearborn County for our Dearborn County businesses?
Absolutely. Currently, we're going through, when St. Elizabeth acquired High Point, there was an occupational employee health nurse and I believe a nurse practitioner that was in that facility 3 half days a week, providing just some follow-up care. We're currently, with Nick and Dalen's guidance, doing a needs assessment, and I believe, thanks to One Dearborn and the Dearborn Chamber, we've sent out a survey. Really would love to hear what employers' needs are as part of that evaluation to see what services the community would benefit from an occupational medicine standpoint. So that's currently in process. It's been kind of a whirlwind for St. Elizabeth Healthcare in acquiring and really adding lots of services and focusing on that community. So we're excited to see what we can bring.
Yeah, and speaking of, if you haven't yet, make sure you take that survey. You can find it on the Chamber's website and at One Dearborn, Mike.org, right? The number one, Dearborn.org.
Yeah. I just put the link in the chat window too, so you can even click on it there.
Well, see, you should have put a link to your website. Make them go to your website first so they sign up for your newsletter. Then they can go to the survey. Come on. It's not your first day, bud.
I should know these things as a marketing guy.
That's right.
One question I have for Dalen and Tina, as somebody who's just HR and OC health is kind of a whole new world to me, being a real novice in it. But if I'm a business or manager of an HR department, how do I decide who goes to the ER in the event of an incident versus who goes to business health services?
Yeah, well, like we mentioned earlier in the presentation, if it's not life or limb threatening, we can actually do that here at our facility. We have, again, state-of-the-art X-ray machines. We can handle burns, bruises, abrasions, you name it, we can do it. We have the 2 procedure rooms that we have as well that can handle sutures, lacerations. So the best way to put it is if it's not life or limb threatening, we can treat it here at St. Elizabeth Business Health.
Obviously, if someone is squatted out, they'll take them to the closest available emergency room. Other than that, it's always, unless it's, I always tell people if it's a head trauma, probably an emergency room. Other than that, we're a great place to start because then our physicians are already starting to manage that case for you. We have the beauty of we've worked out a system with all of our urgent cares and our emergency departments to where when an individual is seen for workers' comp treatment, they are discharged with instructions to follow their company guidelines, but also to follow up and schedule an appointment with business health within 24 hours. Our goal is to get them within 24 hours, make sure that there's no restrictions that can make it reportable. We've educated our emergency departments at length, but please remember that occupational medicine is not their specialty. Their specialty is saving lives. So sometimes they kind of forget about the reportability issue, whereas it's in the forefront of our minds when we're treating patients is, if we can prescribe, over-the-counter medication as opposed to prescription strength, we know that's going to help our employer groups as long as it's medically what's appropriate for that individual. In addition to that, we've also worked out a system to where Dalen and I receive every morning a report from our emergency rooms and our urgent cares that tell us every single occupational injury workers' comp case that's been seen across our system. So you as an employer group, if you have somebody that has gone to the emergency room or gone to the urgent care after hours and you need help with getting the notes and things of that nature, please reach out to Dalen. He'll be happy to help get you the things that you need. We used to have a system in place where we would call you, but unfortunately with HIPAA, it's amazing how sometimes people either don't remember who they work for or they put down who they work for that they really don't work for. So we had to be very cautious in our approach with that. But Dalen will also call you and just say, do you think you had an individual in our emergency room or urgent care over the weekend? And if you say no, we'll kind of prompt you to go look at that so that you can see if that was the case. So again, we're your partner in this. If you have needs, we want to hear them. If there's something else that we can provide you with, we want to hear that too.
Any other questions from the participants? Thank you everyone for taking the time to join us today. Big thank you to Dalen and Tina for presenting today and for sort of the ongoing discussions that I think we'll have about continuing a strong relationship. I think everyone so far is really excited with the amount of engagement that St. E's has had here in the past, really in the past few years. It's been excellent and beneficial, hopefully, to everyone. And Michael, did you want to say something? I see you popped up there. Or did I say something wrong and you're going to yell at me or what?
No, I was just enjoying. I was just kind of quietly listening in for a little. I was late getting on, but just wanted to say hi to everybody and thanks for joining us. I think it was a good conversation, and hopefully will lead to more. So.
Yeah, absolutely. And speaking of, if you have any topics that you'd like to hear from St. E's on, they have, we are looking forward to featuring them more in some of these types of events and continuing this relationship. So if you have anything that you'd like them to add, they were great. Hosted our Human Resources Roundtable last week, and they will be continuing to sponsor that throughout the year. So if you missed that, make sure to be on the lookout. We'll be getting more information on those out here shortly. Those will either be quarterly or every other month. We'll see what the demand is, but thank you for your participation in that. Thank you to Mike, and I feel bad for closing just because Mike has such a great voice, and I know that everyone's bummed after listening to my goofy accent when Mike could be kind of lulling us all to sleep with just those great tones. But thank you to Mike and to One Dearborn for helping put this together and for co-hosting this. Make sure you do go to their site, one as in the number one, dearborn.org. Sign up for their newsletter, get all kinds of great stuff from them. Hopefully we can convince Mike to start releasing that as a podcast so we can listen to him on demand. And lastly, we do still have money. The Southeast Indiana Chamber Foundation does still have funds available in the Dearborn County Revolving Loan Fund, up to $50,000 to any business impacted by COVID, which is everyone. I think it'd be more difficult for you to prove that you weren't impacted over the last year than to prove that you were. Those are low interest loans, great terms, great rates, not as great as the free money that the government might give you, but we are trying to be competitive on some of this stuff. So we're trying to get it out there. So if you are interested or know of any business that is looking to expand or invest, make sure to have them reach out to me here at the chamber. And with that, unless anyone has anything else, stay tuned. Events are happening. Things are moving forward and life is getting back to normal. Get vaccinated, right, Michael? That's important. Yeah. And thank you to everyone for your time, and enjoy the rest of your day.
Thank you.
Thank you, guys.
Thanks, guys.